Welcome back to In Focus. Thousands of residents in Kibera, in Nairobi's Kibera slums, do not have health care. Their only hope lies with non-governmental organizations that run health clinics across the densely populated area. I recently visited the Médecins Sans Frontières clinic, which treats thousands of patients in one section of Kibera known as Gatwekera. The Gatwekera Kibera MSF clinic offers free integrated HIV, TB and primary health care to residents. Dr. Lisbeth Olach is the medical focal person at the MSF Kibera project. She says although many residents are aware of the services offered at the clinic, MSF also conducts outreach programs to ensure as many people as possible know about the clinic.
We also do have a health promotion team, and they go out, they do outdoor activities, they move from house to house to inform them on what we do, also to give them specific informations. If we have, for example, a case suspected cholera, they will go out to the community to try to find if there are maybe other suspected cases somewhere in the houses to bring them to the clinic.
The small clinic conducts up to 200 primary health, HIV and tuberculosis consultations daily. The clinic also provides counseling, nutrition and social work services. David Some is a clinical officer with MSF.
We have HIV consult. These are patients within our cohort. These are clients that we already have enrolled, and we continue enrolling them even today. Like for the HIV enrollment or the HIV cohort, we have in this particular clinic, I think, over 2,000 active cohort of patients that come here daily. Then for the outpatients, it's a mixture. We have patients that are new to us, and I can't really give you in terms of percentages who are new. Like you can see, Kibera is really dynamic, and patients move in, patients come out. We have new people moving into Kibera from upcountry, and that's how we still see new people that have never been to our facilities still coming.
The clinic does not operate without challenges. Widespread poverty and low literacy levels mean that people may not know about the services, checkups, and the importance of treatment regimens for TB, HIV, and the like.
Because of limited information that they have about our services, can lead to them not coming to us. So I think that is quite huge. And then we have people coming out for diagnosis. HIV, the fear of HIV. They may not know what future holds for them. So knowing their status can be challenging for them to come here for them to come to be tested by us. We have TB patients as well that might not want to come to be diagnosed for TB because they think once I have TB, that is like death, or if I have TB, I have HIV. And those two diseases, to separate them, they think TB is HIV. And without them coming out, because of that fear, they wouldn't want to come for diagnosis.
Rhoda Kendi is among patients who have benefited from the services at the MSF clinic in Kibera. She says prior to going to the clinic, she was very ill and could not even eat due to painful sores in her mouth. At the MSF clinic, she was put on antiretroviral medication and taught about proper nutrition and managing her illness.
Since I started taking the services here in MSF Gatwekera, it has been good now. I'm healthy. I'm even a health educator. I educate the others there because now I gained strength. I can do my work. I can educate my children. I'm a single mother. Yeah, so I can educate my children.
How many children do you have?
Three daughters. Life can become normal. Life becomes normal. So long as you get tested and you accept it and you start the medication, life becomes normal.
The free health services provided by MSF and other organizations in Kibera are literally keeping thousands of residents alive. Officials at the Gatwekera clinic explain more about the MSF Kibera project.
There are always continuous health education that is being offered by the health educators on various topics that are health related. So this goes on. We have various promotional health educational materials like the posters that you find here for cough hygiene. We have also the TV where we run various health related health promotional videos that the patient also can see as they are waiting to be served.
We see some categories of patients. Either those who are visiting for the first time, they want to be tested to know their status. So we pre-counsel them to make sure they are ready for the test. Then we do the testing here. It takes about 10 to 15 minutes to know the results using the rapid test kits. And then we prepare the patient to be able to understand how they are going to live with HIV if they are HIV positive. If they are HIV negative, we take them through information session just to help them understand how they can stay without being infected. We also do what we call adherence counseling for patients who have started on ARVs, so that they are able to understand the importance of following the treatment without failing, so that the treatment can help them live longer.
Mine is to ensure that each and every patient accesses essential medical care, social needs being enclosed in their day-to-day lives. Trying to solicit for them how they'll access food by talking to well-wishers, whoever is interested to support them. Trying to fundraise for the kids education, I mean. If we are looking for school fees, who can come in to help? If you are looking for clothing, who can come in and help? And lastly, just to ensure each and every kid has a smile at the end of the day.
I'm about to do what we call a PCR test, where I'm supposed to take a sample using to be put here on this paper called the dry blood sample paper, so that it is transported to a laboratory so that they carry out a test called PCR, which is much more specific in identifying whether the patient who is a baby at this age is HIV positive or not. And then we can be able to know how to take care of the baby, what counseling the mother needs for the baby. So now I've talked to the mother, who is aware about this test and now has prepared the baby, as you can see, and she's ready to have me take the sample to then it is taken to the lab.
The HIV itself, because of the low immunity, the patients who are infected with HIV, there's an increase, more chance of getting the TB. And TB itself to HIV, it increases the morbidity. That person falls more sick. It becomes more, feels more, I can say the severity of the illness of that patient is more with a patient who has HIV than who doesn't have.
MSF runs 3 different clinics in Kibera, but says that due to the vastness of the slum dwelling, they're like a drop in the ocean. The Kenyan government also supports some programs in the area, sometimes taking over those that had been started by NGOs.